Here's a proposition that merits the public's attention and cooperation. The idea is to ease unnecessary pressure on the staff of the Accident and Emergency Unit at the Georgetown Public Hospital and at the same time reduce the time outpatients have to wait to get medical attention at the institution. According to the chief executive of the Georgetown Public Hospital, Brigadier Retired George Lewis, there is a public misconception about the services the emergency unit provides. In responding to a question from Nightly News, Mr. Lewis used the opportunity to clarify what can be done as an alternative to most of the cases that do not need the services provided by the Accident and Emergency Unit.
The Accident and Emergency Department is meant to attend to certain type of injuries, trauma type of injuries, accident, and so on. For the person who have a common cold, that is not the place to go. The place to go is the medical outpatient department, which happens to open until 8 p.m. every single day. Well, except Sundays. So if a person has a common cold, a cut on the leg, then I advise them not to go to the Accident and Emergency Department.
The chief executive further noted that based on observation, patients who are given priority over those who wait for hours create an uneasy situation for medical personnel on duty.
But if there's a person that goes to the Accident and Emergency Department with a pain in the chest or multiple accident with broken limbs and bleeding profusely, obviously, you, the person who goes there with a headache, will not be attended to. Priority will go to the person whose life is threatened. And that is where the issue occurs.
Mr. Lewis reiterated the point that doctors who attend to patients in the emergency unit usually prioritize by treating cases considered emergencies well ahead of cases considered minor ailments.
But the person who would be attended, we will attend to the person whose life is at greater risk before the person whose life is not at risk. And that's what I'm saying. That's why I'm saying Accident Emergency Department is meant to deal with trauma type injuries. Medical Outpatient Department is meant to deal with the routine type of injuries, common cold, cuts, bruises, and so on.
Javon Vickery, HGP Nightly News.